Good evening, and welcome to Healthcare Radio with a graduate student from Temple University named Kaylee Cruz. And she is going to be enlightening us tonight on the topic of stroke. Kaylee?
Oh, yes. Thank you for having me. So to this day, stroke is the leading cause of disability for the United States, with approximately 795,000 diagnoses annually. This breaks up into a mortality of 146,000 and a morbidity of 649,000. Additionally, the sheer cost of stroke-associated care is over $100 billion a year. The importance within public health is that if people are aware of the risk factors, they can mitigate some of them. Also, should anyone have a stroke, when symptoms are caught early on, rapid treatment can greatly improve population mortality and morbidity. Prior to being named as stroke, this phenomena in Greek was known as apoplexy, meaning to be struck down by violence. Another term used commonly referring to stroke is cerebrovascular accident, or CVA.
Wow, that's pretty interesting, Kaylee. What do you believe is the incidence and prevalence of stroke, or CVA, as you say?
Yes, so again, the CVA has now affected younger people aged 18 to 44 years. Well, for people over 45 years, the numbers have stayed consistent, and it's important to differentiate between the two types. Most commonly diagnosed is acute ischemic stroke. This is an occlusion by way of a blockage in the brain. This blockage creates a lack of oxygen-rich blood that would otherwise oxygenate cellular tissue, allowing them to carry out usual metabolism. Without the right flow or complete occlusion, the brain tissue begins to die in 4 minutes, causing necrosis from the hypoxia. With there being levels of cell damage, the most severe is cell death, while the less severe is cell shock. In stroke language, the volume of cells that are only under shock can be salvageable and is known as penumbra, yet if still uncorrected can lead to cell death. Reperfusion interventions look to reinstate the blood flow to this at-risk penumbra. These may qualify for tissue plasmin activator, known as TPA, a clot-dissolving medication, or clot retrieval procedure if there is a large vessel occlusion. The second kind of stroke that is less common is a hemorrhagic stroke, meaning an active bleed. The quickest way to differentiate between these two is by computed tomography or a CT scan of the brain. The other problem with hemorrhagic is it displaces pressure in the cranium from the volume of blood, causing further deterioration in the patient. Hemorrhagic strokes are therefore much more difficult to manage and can qualify for replacement of clotting factors through the IV, an endovascular procedure called coiling, and in certain cases, TPA. Thankfully, these occur less regularly than their counterpart. The short-term effects of stroke can result in pain, confusion, trauma, or death. Long-term effects are morbidity, which are physical or mental characteristics. A couple are aphasia or disability in expressing oneself or interpreting others around you. Another can be paresthesias or paralyses, which can either weaken a side or completely paralyze the side of the body.
Who are most at risk for these things, Kaylee?
Sure. So since there are two kinds of stroke, ischemic and hemorrhagic, the predictors of the disease vary slightly. For ischemic strokes, they can occur mainly due to occlusions from risk factors over time, such as diabetes, clotting anomalies, hyperlipidemia, otherly known as high cholesterol. All of these factors mimic the same physiologic change of plaque formation around the vasculature, lessening or occluding blood flow. Now, for other populations, other more quick risk factors could be the use of smoking, birth control, other hormonal replacement methods, and furthermore, it can also be due to general obesity rates that have increased and highly correlate to heart disease, a confounding factor in stroke. Now, for hemorrhagic or a bleeding stroke, the area of the brain had underwent too much pressure or sudden trauma, and therefore the risk factors could be trauma or vessels that have a high elasticity, allowing for an aneurysm to balloon out and burst, and then high blood pressure. So trauma can break down even more into car accidents, blunt forces to the head, drugs such as cocaine, methamphetamine, or simply falls. In the elasticity side, it can break down into EDS or Ehlers-Danlos syndrome. And going again to focus on high blood pressure being one of the biggest factors in this hemorrhagic stroke. And this is why Americans are aggressively treated through achievable lifestyle change and or antihypertensive medication.
Well, that's fascinating, Kaylee. Can you describe for us here a vulnerable population and exactly what their health disparities are?
Sure. So a vulnerable population that has been affected by stroke and access to care is the Native American population. It was found that in particular their disparities are tied to health access related to socioeconomic status and health literacy related to lack of education. Health literacy plays into processing health information and the ability to act on that information. The University of Minnesota in 2019 performed research using logistic regression that found Native Americans, adults with a lack of knowledge about stroke, were likely to be older in age, less educated, uninsured, rural, male, and without a consistent primary care provider. And basic medical knowledge is imperative for anyone to recognize the first key signs of stroke for timely care, as well as just knowing what the risk factors are to try to get around that diagnosis in the first place. Another study used is the behavioral risk factor surveillance system. For over a couple of years, found that Native Americans were at a greater risk of having pre-existing conditions such as diabetes and hypertension, which, as we know now, are risk factors for the stroke. Furthermore, the study found that despite having the Indian Health Service, there was a surprising number who reported being uninsured at 19%. A couple of recommendations can be having a community health care worker program that trains lay people to provide culturally appropriate health information to peers and communities. They can encourage healthy behavior, help modify certain risk factors, continue to encourage seeking a consistent primary care provider, and continuing medication adherence should some people already be prescribed for stroke-lowering agents. They can even help serve as liaisons between communities and providers.
This has been a very interesting and enlightening topic tonight, Kaylee, but unfortunately we're almost out of time. I would like you to give us a little idea if you want to add some more things to that or kind of sum it up for us at this point.
Oh, sure. So outside of recommending healthy lifestyles, a simple acronym for recognizing stroke signs and symptoms out in the community is BEFAST, B-E-F-A-S-T. B standing for watching balance, if you're seeing someone who suddenly has a lack of balance. E is eyes, a person may have a visual disturbance. F is facial droop. A is an arm droop. S is slurred speech and or a smile that is also uneven. And then T representing time and treatment and noting the time. And if noticed, please alert the local emergency medical service to start the stroke care cascade to rule out or look to treat the stroke.
Thank you so much, Kaylee. It was fascinating tonight.